So today we are going to discuss on the hazards of blood transfusion, right? We know transfusion medicine is a bigger department which is growing up, and often we face various problems of blood transfusion, right? So hazards of blood transfusion can be divided into two parts. One is the hazards of matched transfusion, and secondly the hazards of mismatched transfusion. Okay. Whenever we are going to talk about blood transfusion, another term will come up very soon, and that is called massive blood transfusion. Okay. First we have to know what do I mean by massive blood transfusion. Previously it was defined as administration of more than 5 liters of blood in around 24 hours, right? This was the previous definition of massive blood transfusion. Currently the concept is if you are administering 6 units of packed RBC, 6 units of fresh frozen plasma, and 6 units of platelets. That means packed RBC is to fresh frozen plasma is to platelets. If you are giving that in a ratio of 1:1:1, then that will be said to be massive blood transfusion, right? So let us first discuss the hazards of massive blood transfusion. Okay. So number one, you see, whenever you are administering a large volume of blood in a very small period of time, you are not getting the time to warm it up. Okay. So when you are administering that cold blood, a huge amount of cold blood in a small period of time, the patient will soon develop hypothermia. Okay. And please remember, hypothermia is the most common complication of massive blood transfusion. Okay. Now second, whenever you are giving this blood contains citrate, because we are using citrate as an anticoagulant. So this blood is containing citrate. Now this citrate, over a period of time, if you are administering in a large amount, that will result into citrate toxicity. So what will be the manifestations of citrate toxicity? Number one, citrate will be converted to bicarbonate. This bicarbonate level will increase in the blood, resulting into something called metabolic alkalosis, right? We know that the normal pH of blood is 7.35 to 7.45. So here the pH will rise above 7.45. So we call it metabolic alkalosis. Okay. Number 3. Now whenever you are giving citrate in the body, this citrate is an acid. So this citrate is a negative ion. This will combine with calcium, resulting into calcium citrate complex. Okay. So the free calcium concentration in the blood will drop because all the calcium will be taken up by the citrate. So the free calcium concentration in the blood will decrease. Now that will result into hypocalcemia. And we all know hypocalcemia patients come with manifestations of tetany. So the 3 major complications of massive blood transfusion include hypothermia, then metabolic alkalosis, and tetany. Okay, so that is all about massive blood transfusion. Now we are going to discuss about the hazards of normal blood transfusion. Okay, now, so what are the hazards of mismatched blood transfusion? Obviously, now this mismatched blood, when it is going inside your body, you have not matched the blood group, so that will result into destruction of the RBCs. So the first manifestation will always be hemolysis, right? Now usually this hemolysis is intravascular hemolysis. Okay, this is an intravascular hemolysis. So RBCs are getting broken down within the blood vessels. So in the blood vessels, RBC is broken down, and this RBC is liberating out the hemoglobin. This hemoglobin will be taken up by a protein in the blood called haptoglobin. So that will form a haptoglobin hemoglobin complex, this haptoglobin hemoglobin complex will go up into the tissue macrophage system. This tissue macrophage system was previously called as the reticuloendothelial system. Okay. Now this tissue macrophage system will take up this complex haptoglobin hemoglobin, and there this hemoglobin will be further metabolized to produce bilirubin. Okay. What is the normal total bilirubin level? So the normal total serum bilirubin level is 0.3 to 1.2 milligram per deciliter. Okay. So when the amount of bilirubin in the blood goes more than 2 milligram per dl, that is called jaundice. Right. So jaundice will be a manifestation of mismatched blood transfusion, but I guess you can realize that this entire thing, the formation of enough haptoglobin hemoglobin complex that will go up to the tissue macrophage system, that will be metabolized to form bilirubin, this will take a lot of time. So hemolysis is an early manifestation, whereas jaundice will be a late manifestation of mismatched blood transfusion. Moving on. Now these RBCs will also form clump. So these clumps will obstruct the micro vessels of the body, like they will obstruct the capillaries. Okay. Another very important thing, these clumps will basically clog the renal vessels. So the blood supply to the kidney will be compromised. Okay. So that will contribute to something called acute tubular necrosis. Acute tubular necrosis. So the kidney of the patient will start to die. Okay, so you have given blood for some different cause, and now since you have just not checked the blood group correctly, you have led to failure of the kidney of this patient. Okay, so now that is a serious complication, and how will that manifest? The patient will come to you with manifestations of backache. So backache is going to be a prominent feature. Okay, so whenever you are hearing about backache after a case of blood transfusion, please consider it to be damage to the kidney and reconsider whatever sample you have given to the patient. So this is also going to be one of the earliest manifestations of mismatched blood transfusion. Okay. Now we are moving on to the hazards of matched blood transfusion. So you have done your duty well. You have matched everything. You have checked the details. You have filled the form correctly. You have matched the patient. You have given the correct blood group. But even after that, some complications can develop. So we are here to study what are the complications of matched blood transfusion. And for that, I have made a mnemonic. I miss my family today. I miss my family today. I stands for infections. Miss stands for, again, metabolic alkalosis, right? Now my means mismatched blood transfusion, which we have already discussed. Family stands for a very important thing, and that is called febrile non-hemolytic transfusion reaction. Febrile non-hemolytic transfusion reaction. It's a very important complication. Rather, it's the most important complication of matched blood transfusion. Okay. And today, three things stands for the letter T here. The first T is tetany. Second is something called TACO. And the third is something called TRALI. Right. So these are the possible complications of matched blood transfusion. So let us see what are the details. Metabolic alkalosis we have already discussed. Okay. Now, tetany we have already discussed. Now, one thing about metabolic alkalosis, whenever there is metabolic alkalosis, that means there is increased bicarbonate in the body. So the pH will increase. And we know that that is inversely related to the potassium. So due to that metabolic alkalosis component, the potassium in the blood may drop. So that can lead to hypokalemia. That can lead to hypokalemia. Okay. Again, we have already read about hypocalcemia leading to tetany. Now, if it is a sample containing prolonged storage blood. So if it's an old blood sample, old blood vial which you are giving to your patient, so what will happen? That will automatically lead to destruction of the RBCs, a few RBCs in the system. Okay, that will lead to liberation of potassium from inside the RBC to outside. So potassium will be released into the blood, and when potassium level increases in the blood, that will cause hyperkalemia. So please note, both hypokalemia and hyperkalemia can be complications of matched blood transfusion. Okay. Also, whenever you are storing the blood for a long period of time, another possible pathway that I can discuss is the dextrose in the blood is going to drop. If you have no glucose in the system, there will be no glycolysis in that RBC. So the ATP production in those RBCs will again drop. If ATP level drops, the sodium, potassium, ATPase pumps cannot function. So when the sodium, potassium, ATPase pumps cannot function, the level of potassium in RBC will increase, because we know sodium, potassium, the level of potassium in the blood will decrease, because we know by sodium, potassium, ATPase pump, 3 sodium goes out, 2 potassium comes in. So if there is a dysfunction of this pump, potassium cannot come in the RBC. So potassium level will increase in the plasma, in the blood. So that will again lead to hyperkalemia. So these are the two possible causes of hyperkalemia as a complication of blood transfusion. What is the cause of this febrile non-hemolytic transfusion reaction? Please remember, that is due to generation of HLA antibodies. HLA antibodies are produced against what? They are produced against the platelets, okay, and they are produced against the leukocytes. They are produced against the leukocytes. So that is a major reason for febrile non-hemolytic transfusion reactions. Okay. Another cause of this febrile non-hemolytic transfusion reaction is generation of cytokines in the sample. So these cytokines will also start to destroy the leukocytes and the platelets. So generation of autoantibody, or rather generation of HLA antibody against the platelets and the leukocytes, especially the granulocytes, will lead to febrile non-hemolytic transfusion reaction. Okay. Coming down to the last one, that is TACO and TRALI. Now, what is TACO? TACO is called Transfusion-Associated Circulatory Overload. Transfusion-associated circulatory overload, whereas TRALI is called transfusion-related acute lung injury. So transfusion-associated circulatory overload and transfusion-related acute lung injury, these are the two possible complications after blood transfusion. Okay. Again, this is due to antibody mediated injury. You don't have to know the details of these transfusion reactions, but let us now at least know that TRALI is caused due to antibody mediated injury and TACO is caused due to more fluid in the system. You see, it's a circulatory overload. So TACO is caused due to a circulatory overload. Okay. So these are the two again important things which you must note. This TACO and TRALI differ in many aspects, one of which is related to blood pressure. In TACO, the blood pressure goes higher than normal, whereas in TRALI, the blood pressure remains to be normal. Please remember, in TRALI, every parameter that you check, whether you check the blood pressure, whether you check the pulmonary capillary wedge pressure, pulmonary capillary wedge pressure, whether you check the BNP levels, that is brain natriuretic peptide, everything will be elevated in TACO compared to TRALI. Okay. So every parameter that you check will be elevated in TACO over TRALI. The only exception is ejection fraction. The ejection fraction in case of TACO will be less, and in case of TRALI it will be more. So these are the various aspects and complications of blood transfusion which we must be aware of and which we must take steps to prevent.